I was in the Marines, U.S. Marine Corps, and 1968 to 1970.
Wayne started having problems with his executive function, and he wasn't able to perform his job. It just took us a long time to figure out what was going on. So we went to a psychiatrist, and he felt something was wrong, but he didn't think it was Alzheimer's. He thought it was something unique. So he sent us to another neurologist, and that neurologist was very quick to diagnose Alzheimer's. We did 3 more neurologists, and they concurred that it was Alzheimer's. And it wasn't until Wayne went to do a sleep study that an intern said, "I think you have PSP."
Good. Spread out your fingers, relax them. Very good, just like that. I first met Mr. Johnson in August of 2012. And now underneath your chin, like this, without touching. He reported several issues. One was related to progressive loss of balance and falling. And the other was progressive personality change, along with some word-finding difficulty and other thinking changes. And now, without moving your head, just follow my finger, please.
When he examined Wayne, he had other doctors come in also to see what was happening.
And now all the way up. And try to work down as much as you can. Very good.
And they all concurred that he had PSP.
We should start by briefly characterizing the cardinal features of Parkinson's disease, also referred to collectively as Parkinsonism. These clinical features include a tremor at rest, slowness of movement, called bradykinesia in doctor speak, as well as a postural instability, loss of balance, and finally rigidity, which means stiffness, resistance to passive movement.
Atypical patients differ from traditional Parkinson's disease patients in several ways. They may have early mobility issues, specifically early falls. They can have more cognitive changes that are early. They can have autonomic dysfunction that results in symptoms like dizziness or more frequency in urination. And they can have visual changes.
He had a gradual decline in his executive function, and it took several more years before all the other symptoms came through.
My memory is vanishing slowly. And what I'm saying is Parkinson's has a way of, I can't remember.
I've come to realize his depth perception is off, because he would like reach for something that was, he kept reaching and then he'd be top heavy and it just would pull him over. He didn't realize how far away he was, and then his brain doesn't think to move his feet.
I plop a lot. And my feet, when I don't focus, I lose track of where I'm going.
The worst fall was 2 o'clock in the morning. I heard a loud crash, and he was in the middle of the glass coffee table with shards of glass sticking up all around him. That was really scary, that one.
In general, the medications that we use for Parkinson's disease do not tend to have the same benefit in the atypical Parkinsonian disorders. In fact, one of the ways we define typical Parkinson's disease is by its robust and clear response to medication like carbidopa-levodopa. This is not something that we usually observe in the atypical Parkinsonian disorders.
So as far as treating the motor symptoms, the Parkinsonism, again, the slowness, the stiffness, the tremor, there are no separate medications that we can offer beyond what we have available for Parkinson's disease patients. There certainly are medications that can help some of their symptoms.
So you want to address their quality of life. You want to make sure that they have something in place for their their balance difficulties. You want to make sure that you're monitoring closely for mood changes, for cognitive changes, and you want to make sure that you're addressing any behavioral changes that they may have.
And you're still getting out socializing and interacting with other people.
The social worker got us physical therapy, speech therapy, and occupational therapy, and they all came to the house last year. So he was a very busy boy.
Because that's something we can get through the VA as well.
But it was great because it was like a socialization period for him, so he enjoyed doing it because the people are very nice.
I would say that it's absolutely crucial for patients with atypical Parkinsonism to exercise and move as much as possible. Exercise is very important, and in the case of my patient, Mr. Johnson, it's certainly something that has benefited him.
We belong to a gym, and we go to the gym at least twice a week. Also, we walk the dogs because we're trying to keep his strength up so he'll be able to walk as long as he can.
Well, when I exercise, I feel much better. I feel like that's what I should be doing. When I don't exercise, I would imagine I'd lock up.
We have an increasing amount of data in typical Parkinson's disease that exercise not only can help with balance loss and a number of other symptoms, including mood, but it can actually potentially slow down progression of disease. The atypical Parkinsonian disorders progress more quickly than Parkinson's disease. And while we generally tell patients that you will die with Parkinson's disease as opposed to of Parkinson's disease, that's not something we can say for the atypical Parkinsonian disorders that do tend to shorten one's lifespan.
What I know is it's not good.
In the care for atypical Parkinson's disease, no matter what the diagnosis is, it is important for the patient and the caregiver to maintain hope and to be in contact with their healthcare provider team so that we can address the symptoms as needed and maintain the best quality of life that we can give them.
I try not to look down the road at what's going to happen. Try to just do all we can right now to lead a full life. I'm trying hard to keep his socialization up so he's not just sitting home watching TV, one day at a time.
I'm fortunate. She's been taking care of me.